Okay, so as people continue to introduce themselves, I will start this webinar. Thank you so much for joining us to hear today about supporting Ontario health teams in meeting their requirements under the French Language Services Act, and particularly around the active offer training in support of meeting those requirements. And so my name is Anna Dion. I'm a knowledge worker with RISE. And we have the privilege of hearing from our three panelists today about the active offer training in the context of supporting OHTs. And so first we'll hear from Jillian Paul, who's the director of the OHT Integrated Policy and Planning Branch with the Ministry of Health, to set the stage for our webinar. And then we will hear from Diane Cutas, who's the executive director, and Sylvie Sylvestre, who's the community engagement and planning officer with the Réseau du Mieux-être francophone du Nord de l'Ontario, to share more about the active offer training and how it can specifically support OHTs in their work. And so before we begin, I would like to open today's webinar with a recognition that many of us are joining from many areas across the province, and that all of Ontario is subject to treaties and other agreements with Indigenous and First Nations communities. And we all have the privilege to live and work in these territories, as well as the responsibility that we carry with First Nations, Métis, and Inuit people who are the traditional guardians of this land. I am joining today from the traditional and unceded territory of the Algonquin Nation in what we now call Ottawa. And I'd like to recognize the Algonquin Nation as the traditional guardians of this land. And I'm grateful for the opportunity to work and care for my own family here. And for me, this also comes with a responsibility to continue learning with and from the Algonquin community and honoring their leaders, past, present, and future. And so I also would like to invite all of you to learn more about the communities and territories where you live. And so I'd now like to hand the floor over to Jillian Paul, Director of OHT Integrated Policy and Planning Branch with the Ministry of Health, to set the stage for this webinar. Jillian.
Thank you so much, Anna. And on behalf of the ministry, I just want to thank you all for being here today, but also thank the organizers for allowing me to provide some opening remarks. And I first just want to apologize that I'm not going to be able to stay for the full webinar, but Leanna Mora from my team will be here for the duration. So perhaps if we could go to the next slide, please. As you may know, the preamble of the Connecting Care Act of 2019 does include an acknowledgement that the people of Ontario and their government believe that the public health care system should be guided by a commitment to equity and to a promotion of equitable care outcomes. And the public health care system should recognize the diversity within all Ontario communities and respect the requirements of the French Language Services Act in the planning, design, delivery, and evaluation of healthcare services for Ontario's French-speaking communities. As defined by the Ontario Public Health Standards, health equity means that all people can reach their full health potential and are not disadvantaged from attaining it because of their race, ethnicity, religion, gender, age, social class, socioeconomic status, or other socially determined circumstance. And I think it's just important to sort of set the stage with that. Next slide, please. So with that, the Ontario Health Team model does value health equity as a critical principle and improving equitable access to care for diverse populations, including Francophones. As outlined under the OHT guidance document released in 2019, which was sort of the first document put out to describe the vision for Ontario Health Teams, which is available on the ministry's website. OHTs are intended to redesign care in ways that best meet the needs of the diverse populations they serve, including respecting the role of Indigenous peoples, racialized communities, and Francophones in the planning, design, delivery, and evaluation of services. Furthermore, as part of the OHT application process, each team's full applications are assessed to determine the extent to which teams engage with their local French language health planning entity and how teams will improve experiences and outcomes of Francophone populations. This includes working towards implementing the principle of active offer. As well, the need to comply with the French Language Services Act and working with the French language health planning entities on health planning activities it has been a requirement of all OHTs, all approved OHTs in their receipt of their implementation funding, so through their transfer payment agreements. So I think it's important to emphasize that the ministry does acknowledge that teams are at different stages of implementation, and some teams are at very early stages of implementation. Currently, OHTs are focused on the engagement and inclusion of Francophone communities in the planning and design of services. And I'd say OHTs are focused on the engagement and inclusion of all their communities, and they are really at the planning and design phase of their work. But as OHTs mature, the ministry is through the development of resources and tools to build OHT's capacity to support the delivery of French language services. Next slide, please. So just a bit of an update. So to date, there are 50 approved OHTs across the province, including in areas that are designated under the French Language Services Act. All provider organizations that are currently designated under the FLSA must continue to comply with the requirements of the Act, whether or not the provider is a member of an OHT. A provider's membership in or partnership with an OHT does not affect its legal responsibilities to provide health services in French, and providers designated under the FSL will continue to provide French language services in accordance with the requirements of the designation. Moving forward, OHTs present a critical opportunity to address long-standing issues of health inequity and ensure that OHTs at maturity are responsible for providing healthcare services that meet the needs of their communities and recognize the value of French language health services to work to achieve a person-centered system of care for all Ontarians. Encouraging the principle of active offer, which I know is of top of mind today, and health service planning and delivery is a commitment to ensuring Francophones in Ontario are served in a manner that meets their needs. So I'll now turn it over, I believe, to Diane and Sylvia to provide a presentation on active offer training.
Great, thanks so much, Jillian. So Diane and Sylvie, I will pass the floor to both of you to share. You should be able to share your screens now.
Thank you, Jillian, for that opening, and Anna. A pleasure to be here today with all of you to talk about how we can support the OHTs to meet the requirements under the French Language Services Act, and particularly focusing on active offer of French language services and the online training that we've created to assist with that. I'm Diane Quintas. I am the Executive Director of the Réseau du Musée francophone du Nord de l'Ontario, and I have with me Sylvie Silvestre, who's the Community Engagement and Planning Officer for the Cochrane region here in Northern Ontario, but she is also our main lead on the active offer training program. The slides are available in French and English, or will be made available in French and English on the RISE website, as well as the recording Stephen, I think, put in the chat, will also be available to those who participated and those who unfortunately had to miss it, because although everyone wants to be here, I'm sure not everyone could be. So we're going to start today's webinar with a little bit of a question for all of you. It's done, this poll is done using Slido. So you can either use your phones to take a picture of the QR code there at the top. You can also go directly on your web browser, slido.com, and type in those numbers there, 876-828. Or you can also look in the chat. Manon from the Réseau just gave you a link to the slide there, and some people are already in. And we'll just get you to put in your answer, and we'll see as people answer what their knowledge is of active offer French language services, whether they've completed the training already and know about it, whether they're not familiar with it at all and are here to learn, whether they know a little bit, want to know more, or whether they know a lot about it. So seeing those numbers come in and those lines move around, we'll just give it a little second here to give people a chance to connect. Just to let you know, once you've connected to the Slido, you'll be able to just stay on that page on your browser or on your phone. And every time a new little quiz comes up, the new questions will pop up automatically. So you don't have to sign in automatically every time. It'll just do it automatically for you. We seem to have a bit of a lull here at 42 participants that have entered answers, and that's okay if you're not comfortable with answering, although we do encourage you to do it because it's kind of fun to see what people are aware of and what they know about active offer. So we'll stop here and go on with our presentation. So again, the active offer French language health services is our topic today. I'll start by talking a bit about language, and just to kind of underline the fact that language really is essential to the improvement of health outcomes and self-management for one's own health. So from the patient perspective, language plays a role in ensuring that they are able to be full participants in their healthcare. The language is also related to the ability to care, help, advise, guide, educate, and provide quality healthcare. So from the health service provider's perspective, language is an important tool that can be used to ensure that there's quality and safe care provided to their patients. It's important also to understand the reality of francophones, because although some francophones may be bilingual, as myself, so first language is French, grew up speaking French only up until about the age of 2 or 3, then learned French. In crisis situations, when we're ill, when we're nervous, right now I might have a stronger accent than I might in other times, or none at all, depends on how I'm feeling. But people often refer to their mother tongue in situations where there's a little bit more crisis or tension, or when they're sick. And for that reason, it's important to ensure that they're getting their services in their mother tongue when discussing their health, because they might not find the right words. I was practicing earlier and I couldn't think of the word poll. It just came to me in French, le sondage, and they just don't come as naturally. And so especially with something as important as your own health, it's important that the services be available and that the patient be able to express themselves in their mother tongue. And we'll talk more about that a little bit later. There are, of course, some groups that are much more vulnerable than others when it comes to needing services in their own language, and children being one of them. As I mentioned before, up until the age 2 or 3, I did not speak English. Seniors, as we get older, we often revert to our mother tongue, especially when illness comes into play, dementia, and whatnot. Newcomers and immigrants. So, for example, many people coming from other countries might have another first language, and then as a second or a third language, they've learned either French or English. Well, some of them haven't learned English. English might be the 7th language that they know. So they're even more vulnerable because of the fact that they're also struggling with learning a new healthcare system in a language that they're not familiar with, and they're better of the two between French and English is going to be French, because it is a language they might speak at home and send their kids to French school, etc. Individuals in crisis, as I mentioned before, and people at the end of their life. So what are the positive impacts of French language health services for Francophone clients? Well, there are many. As I mentioned before, the ability to express their needs and explain their symptoms. Sometimes we are unable to really express how we feel, especially when we think about mental health issues. Emotions are expressed in your language, in your mother tongue, but even where it hurts, sometimes it's hard to explain if you don't have those words. We're better able. The Francophones are then better able to understand the treatment plan and adhere to it. If they've understood what was told to them, the importance of the client, improvement of client experience, and then better health management. So if they've understood their treatment plan, they're more likely to be more involved in health management and taking care of their health and following the guidance that has been given to them. For the health human resources, there are also positive impacts to being able to offer French language health services. First of all, and one of the biggest things is it improves the accuracy of health assessment. You're able to fully understand what the patient is expressing in terms of their health issues. There's better interpersonal interaction during the treatment. More effective communication, obviously, and an improved experience overall for the staff and the healthcare professional. And in terms of the healthcare organizations, providers, the healthcare system, there are also positive impacts of French language services, and that's increased quality and safety of care. I touched on that a little bit earlier. we all want to work towards person-centered approach, and language, being able to serve that client or that patient in their language is the utmost of patient-centered approach. You're really focusing on the needs of that patient if you're able to respond to their needs of language, their language needs. Reduce problems related to service delay and better risk management, and yes, also reduce costs. You know, if as a francophone patient goes into for treatment, receives direction on the medication they need to take for 7 days. They need to finish their medication, but after 2 days, they're starting to feel a bit better, or they stop taking the medication, they start going back to physical activity, which were recommendations they weren't supposed to have. They're back in the emerge dealing with secondary issues. A second time, a third time, a fourth time. So there is definitely studies that demonstrate that there is reduced costs with the ability to offer French language services. So here we have another little Slido active poll for you. In our OHT, our French language service is a priority. And again, if you still have your Slido picture open, that question should appear automatically. If not, you can take a picture of that QR code, click on the link in the chat, or join at slido.com with the number indicated. I'm glad to see that we don't have any nevers. That's encouraging. Although if it is never, don't be shy. It's okay to be honest and let us know. That's why we're here today, to work on improving that and ensuring that French language services do become something that all OHTs are thinking about, specifically those in designated areas, but also those that aren't, because you might still get eventually a francophone patient coming through those doors virtually at this point. But okay, so we'll go on to the next question. Oh, we're still getting a few. That's okay, you guys can still answer. I'll just keep moving on, and you're more than welcome to continue moving on. At this point, I will let Sylvie take over and do her part of the presentation.
Okay. So as we work with health service providers, we're often asked, okay, give me the definition of active offer. You often talk about active offer. What exactly does it mean? So we've explained, you know, it's the action of providing quality services proactively. And then here are the 5 definitions that go with it, or examples. And what we've noticed is that as we support health service providers in the improvement of the provision of French language health services, we were often asked for more concrete examples of the definition, accompanied with some resources and tools. Hence the reason we developed the active offer training. So the definition is that it's available at all times. Here we talk about, obviously, the importance of French-speaking health human resources. It's clearly communicated and it's visible. And examples of this is greeting your clientele with a hello, bonjour, having staff wear some type of identification. It can be the pin that says je parle français. It can be signage as you enter the facilities that are in both French and English. And it's easily accessible. As I said, you know, easily accessible. The healthcare services are easily accessible with the staff. But another example is with the documentation. The documentation is easily accessible. It's not in the back room that is not easily accessible. It's not, you know, on the computer or on a website. It's printed in advance and easily accessible. And we often talk, when we talk about easy accessibility, is that the admission forms, the documents, are in a bilingual format. So whether it's one side in French, one side in English, or even better, one side, both French and English. So one side, the left-hand side is in French and the right-hand side is in English. There's another example. And of course, services in French are equivalent to the quality of services offered in English. Okay. The key elements of an active offer, it's really important that we recognize that there are Francophones in your community, in your region. So we need to identify these Francophones by asking them their mother tongue so that we can recognize their linguistic and cultural needs. Okay, and the active offer of online training does bring about awareness on the accountability of healthcare providers and healthcare staff. And throughout the training, there are many, many concrete examples on how to improve access to quality French language services, such as direct client services, communication, visual identity, human resources, and so on. Okay, so I'll give a brief overview of information on the training. Okay, the training is available in French and English, and it continues to be free. And we started the training with a 5-hour training. So it was an introduction of approximately 30 minutes, followed by 6 modules and that I will describe. So in total, it was a training of 5 hours. Now here in Ontario, and we also have a generic version nationally that is available for other participants in other provinces and territories, which is only the 3-hour version. So modules, the introduction and modules 1, 2, 3. The training is geared towards individuals and students who work in the healthcare field or in another related field. And it's possible to register as an individual or also as an organization by contacting us. And we will set you up if you decide that our training is going to be mandatory for your staff and you want to ensure that it is being followed, you want to follow the progress, have a copy of their certificate of completion, you contact us and we will set up an organization account. Okay, and it's possible to obtain continuing education credits as well. You can just contact your college, your professional college, and inquire if you can get some credits. But with the Canadian College of Health Leaders, by completing the training, and obviously in the training, there is an evaluation at each module, and there's obviously a passing score that's indicated on each of the module. So by completing that, handing in your certificate, you will be entitled to either 1.5 or 2.5 category 2 credits towards the maintenance of your certification requirements. So in terms of the training goals of the online training, it's to discuss the importance of the active offer of French language health services, obviously with people who work or study in healthcare or other related field. And I have to mention that, you know, it's also good for different levels of people in your organization, from frontline staff to volunteers to management to board members. So we really promote in the training the important roles that everybody can play in ensuring the improvement of the active offer. And there you go. So the training is divided into, like I said, either introduction, module 1, 2, 3, or introduction on all of the modules. And we are working on some changes that I will describe shortly as well. Okay, so in the Excellence in Person-Centered Care, it basically describes the general characteristics of active offer And there's a lot of best practices of direct client services, of visual identity, communication, human resources. And there's a really good testimonial from a family physician who discusses the importance of active offer of French language health services. In the second module, equity and safety, obviously it covers the importance of these two concepts in a person-centered approach. Cultural competency, the third module, provides a better understanding of the concept of culture and the elements to consider when providing culturally competent care, as well as the risks that are associated with not respecting the cultural context of Francophones living in minority situations. And this module ends with the case study offering suggestions in providing culturally appropriate care to Francophones in minority situations. The fourth module, recruitment and retention of bilingual human resources. Here you will have a better understanding of the health human resources strategy that was developed by the French Health Network of Central Southwestern Ontario, the Réseau Franco-Santé du Sud de l'Ontario. And this module, which is only 45 minutes, gives a pretty good overview of their online platform that presents the concepts and courses of action to improving access to French language health services. Module 5, work environment and organizational culture, covers the topics of health providers' leadership in order to look at the roles of the different actors in the implementation of active offer, as I was saying, frontline staff, managers, volunteers, board members. It gives a better understanding of the steps involved in developing a bilingual organizational culture in a predominantly English-speaking context. And it outlines the steps in that planning and implementing of French language health services. And then the final module, community engagement for health equity, provides an opportunity to recognize the importance of community engagement with the Francophone community. And it identifies many practices that lead to community engagement with your Francophone community to improve health equity. So changes coming to our platform soon. The 3-hour version is currently available. Like I said, it's introduction modules 1, 2, 3. And then the longer version of the 5-hour course, the modules 4, 5, and 6 will now become complementary modules. So if you are interested in community engagement for health equity, you will have access to only do that one module. And then other complementary modules coming soon. Well, currently that is available on our platform is the long-term care module. So it's titled Culturally Appropriate Care for Francophones in Long-Term Care Homes. And I will describe it in the next slide. But in the months to come, we will have also a module for the mental health and addictions field, and it'll cover some concrete examples of active offer in this sector. There will be a module for primary care, again, with concrete examples of active offer geared towards physicians and nurse practitioners. And the module on Francophone immigrants will cover their experience and raise awareness of providing culturally appropriate care to Francophone immigrants. So I had said that, I would go over very briefly the culturally appropriate care for Francophones in long-term care homes module that is currently available on our platform. It's divided into 4 chapters that you can see here. So we do have some written and video testimonials about the importance of culturally appropriate care for Francophones. and how to implement culturally appropriate care. Then we go on to the second chapter with concrete examples of how to put active offer into practice in long-term care. The third chapter is many examples of culturally appropriate activities for Francophones that have been organized by long-term care homes that we have gone and reached out to, and they provided to us. And actually, I was looking at it this morning, and I'm still very impressed with this module. I'm very impressed with our training, but very impressed with this module, especially since my mother and my dad are in long-term care, and many of the pictures, my mother's a star in it. So it even provides a template of a calendar of activities in French. And finally, the importance of developing partnerships with the Francophone community is another way of providing culturally appropriate care for Francophone residents. And we provide, again, many examples of different types of partners and the steps to implementing this partnership. And finally, just to close off, once you've completed the training, you can actually go and print your own certificate of completion from the dashboard.
Okay, so thanks for that, Sylvie. You did a great job presenting the different aspects of the active offer training. I've noticed that there is a few questions coming up in the chat. Awesome, keep them coming. We're keeping count of them, and we will be answering questions at the end of the presentation, just to keep things flowing with the presentation and all the questions at the end. So please send them, and we'll be happy to continue them. So now I'd like to touch briefly on the RISE building blocks 1 to 8. I know that as OHTs, you're all working on and using these building blocks to help, you know, as you go to maturity, as we speak. So one of the things that I'd like to mention is that in yes, it was a few years back now, we had created a oh, I can't see my presentation. Sorry, my questions are on the side. So sorry if I'm not looking directly at you here. We had created a RISE bulletin with, there it is. I can't find my words. Je trouve pas mes mots. So in collaboration with the entities, we created the RISE brief. Brief was the word I was looking for. Brief number 25, which talks about French language health planning entities and how they can support the OHTs as a health system partner. And so, as it says here, the couple of the building blocks in particular where French language services are you know, really accentuated, and where we really need to be looking at them. So building block number 1 and 4, but also building blocks 3, 6, and 8. And in fact, all of them have some aspects of where French language services can be incorporated. So I don't want to go into all of them in detail, but Sylvia, if you go back to the previous page, I'd like to maybe just, oh, wrong way. Yeah, just talk briefly about 1. So defining the patient population. One of the things that we like to, when we work with the OHTs in our region here in the north, and I know my colleagues in the other entities across the province do the same, is to work with the OHT to look at what's the population, what's the Francophone population in your catchment area? What are the healthcare needs of that population? And how do you identify your Francophone population? So we always like to suggest using the linguistic variable questions with regards to identifying your Francophone patients, clients, and that is, you know, what is your mother tongue? Is it French or English? If your mother, and the second question, if your mother tongue is neither French or English, in which language are you most comfortable offering your services, receiving your service, French or English? And so what that's doing is we're looking at the inclusive definition of Francophones that was established by the Ministry of Francophone Affairs some years back now, that just to take into consideration those Francophones that are not from Canada, like from here, they're newer immigrants to Canada who don't have French or English as their mother tongue, but they're more comfortable speaking in either French or in English. So if I take, for example, my aunt who's in Spain, my aunt speaks Spanish as her first language. Her second language is French. I can have a conversation with her in French. Her kids, however, don't speak French. Their first second language is English. And so if you were to ask her versus them, if they were visiting in Canada and were needing health services, my aunt would say French, my cousins would say English. And so it's important to know that. And because if we're not able to offer services in every single languages, we should be offering them in the languages of, official languages of our province and country. With regards to number 4, so patient care and experience, some of the things we like to talk about is the importance of active offers and the ways of doing that. So this presentation really touches on that. But we also look at ensuring policies and practices are in place, evaluating the patient experiencing, specifically as it relates to French language services. And then just briefly to comment on the other building blocks. So partnership, patient partnership and community engagement. It's important to note that it's not just about engaging with the Francophone community. Yes, we want to engage with the Francophone community, but it's also about engaging with them in a meaningful way that will ensure that we are able to offer services in the future that will meet their needs. That's the whole purpose of engagement, not just to say, hey, how you doing today? But also develop community engagement plan in which you'll incorporate your entité that's going to help you meet those Francophones. And then include those Francophones in your planning, in your consultations, on your committees, and in the co-design of programs and services. If we look briefly at leadership, accountability, and governance, here we talk about the importance of having someone at the governance level, high, VPs, et cetera, that are responsible for ensuring French language services. One of our modules, as Sylvie talked about, module number 5, that speaks specifically to ensuring that at a governance leadership level that we're ensuring an environment and an organizational culture that's conducive to French language services. Including some best practices that we've seen in our region is, including the entité representative on your decision-making tables to ensure that that Francophone lens is always there, helping you as you move forward and build and grow the OHT. Performance measures, we talk about different aspects there as well. And as we go through the training module, you'll see how each of these building blocks will answer questions that you have. And I touched on it very briefly, again, because in the next slide, the RISE brief does include a whole slew of examples for each one of the building blocks. So I don't want to take too much time. I do want to leave more time for questions. Mother tongue, is really the first language spoken by, I just saw a question pop up in the chat, so I have to answer it. The first language spoken and understood by the person. So if we go into the next slide, we're going to go into the different roles that each person, individual, organization plays in the active offer French language services. So to get your Slidos, we're going to start with a Francophone client. The Slido is the quiz, the poll is in the next question. So as a Francophone client, one often asks, what's their role in active offer? Well, we always like to say it's not the responsibility of the patient, the client, to fight for their services when they're sick and vulnerable and needing services. That's not when it's supposed to happen. Their primary concern at that point is to receive the services and to get better and to feel better. And so they're not gonna, at that moment, fight for services in French. The other thing is they're accustomed in many situations, in many places, to not receive services in French. So sometimes they don't even think of asking for services in French. And the third thing is that they've become accustomed, to just assume that everything will be available in English. They've, come to believe that services, if they ask for services in French, they'll have to wait longer, or that the services won't be as good. And so in general, many Francophones might not ask for their services in French, but they do have a role that they can play if they so choose, perhaps not in a moment of crisis, at another time, is to identify themselves as Francophone upon registration when the question is asked to them about their mother tongue. Use the French language health services that are offered, and fill out science satisfaction surveys, especially as it relates to their experience on receiving services in French, and participate in health service planning and governance of organizations. Put themselves forward to sit on the board of a healthcare organization to help provide that Francophone lens. Now's when we're going to move on to the little quiz. As a Francophone health human resource, if you are one, what actions do you take to identify your ability to offer French language services? You can pick more than one of the answers that are there. Again, just as a reminder, if you've just joined us, you can join the poll by clicking your phone and taking a picture of that QR code, joining us on slido.com and punching in that number, or Manon has also just posted the link to the Slido questions there as well. And remember that you can leave that open at all times, and that the new questions will show up immediately. Okay, so we're seeing that a lot of people, this question isn't applicable to them, and that's okay. Perhaps your role is in different area of the organization, in governance, in leadership, whatnot, and you still have a role to play, and we're going to touch on that shortly. But part of that role is also helping health human resources that work in your organization or who are part of the OHT to know what their role will be. So on the next slide, we talk about, and remember, you can still answer the questions even though we change slides. As a healthcare professional, their role in promoting active offer is to, and as some of them people are already doing, is greeting clients with that bilingual salutation. So hello, bonjour, or continue the conversation once they've done that in the language of their client's choice. Identify yourself as a French speaker, so using pins or signage at your desk or wherever you may be, on your voicemail, on your card. But another big part is educating oneself on the needs of the Francophone population and understanding how, culture and past history of the Francophone population in certain areas might affect their ways of behaving and presenting in their service. And then if you aren't able to offer French language services, is being able to redirect those clients to French speaking staff. So OHTs have a big role to play in navigation. And I think that's where this comes into play, being able to redirect or direct their clients, navigate them towards services that will meet their needs, their linguistic needs. So the next question, does your OHT favor an organizational culture that promotes the active offer of French language services? And again, there is the questions, the QR code, the slido.com. I'm just give people another little second here. I'm reading some of the comments and the quotes in the chat there, and we will touch on all of those. So we'll just skip to the next page so that we can keep going and get to those questions. So as a health service provider, what is your role in the promotion of health of active offer? Sorry, my tongue is getting a little twisted here. I'm used to speaking French all day. Have a mechanism in place to determine the linguistic identity of your clients, patients, And we mentioned the linguistic variable questions earlier. What is your mother tongue? And if it's not French or English, in which language do you feel most comfortable receiving your services? Include Francophone community at the governance level. So within the board of directors, if you're looking for someone, or in the leadership roles, etc. Develop a policy on active offer, engage the Francophone community, integrate French language services in strategic planning. Plan, coordinate, and assess French language services, recruit and retrain bilingual staff, create internal culture that promotes active offer, increase awareness of the importance of French language health services with its employees. So one of the things that we've seen is, some of our organizations here have mandated the active offer training to all their staff, so that they learn of why active offer, what's important, what is my role, how do I do it? Provide training to the employees on the legal requirements regarding French language services. Again, all that information is provided in the active offer training modules. Empower the employees in the implementation of active offer. And one last question for you before we go to text questions. If you have not already completed the active offer online training, are you now interested in taking the training? So we'll let people answer this. We'll wait a little while as the numbers go up, and then we'll get to some questions. Okay, so we'll again, we'll just change, we'll close off the slide here, and you can keep answering that question. For more information on the training or to register, you can either register as an individual, you can register as an organization. The email to use is the active offer training at rmfno.ca, or, and we posted in the chat earlier, activeoffer.ca is the website for the training modules. It's also available in French, formationattractive.ca. Alors, you can do that. And with regards to the 8 building blocks, for support with the 8 building blocks, we're just redirecting you to your local entities. Each entity serves a particular Ontario Health region and providers within that region. You can see in some of the signatures talk about the exact areas where they are located. Entité 1, Entité 2 are in the southern areas, Entité 3, Toronto area, Entité 4, north of Toronto and around the area there. Réseau des services de l'Est is Eastern Ontario, and the Réseau du Musée ourselves in the north. It might have been good to put a map, but if you go to the RISE building block, you will see that the map is there, and it really describes the different regions of the different entities. And I think that's the last slide. So thank you very much. We can now go on to questions. I will just start answering some of the questions that I've seen along the way. I had a question about how many participants attended the webinar. The highest count I saw was 84, so really happy to see that. We had a question from Charlotte wondering if it might be helpful to mention persons, client, patients, as well as family caregivers, because we're moving to include caregivers in the conversations. Absolutely. Active offer goes towards anyone and everyone. You know, if you're greeting someone, whether it be the patient's family member, caregiver, they might also have a better capacity to answer questions in French. Are organizations able to build their own active offer training based on what the Réseau has provided, or do we need to use only training from the Réseau? Question from Tammy Ashe. You are welcome to build your own. I'll just tell you, it's been a lot of years of work on our part building this training, and I think it would seem to be a use of resource, unnecessary use of resources to build your own. This active offer training has been supported by all 6 planning entities, has been made to represent all of Ontario and also to touch on some regional differences within the training. We also have the ability to register your organization as a group, as Sylvie mentioned earlier. So for example, if the whole OHT wants to be able to monitor, or the organization wants to be able to monitor the progression of their employees or their staff or whoever it may be, you can register as a group and follow through that way as well. And but if you'd like, more than welcome to chat about that offline and see if there's something that's missing that we can offer you differently. I know in most of the regions, the entities also will provide on the spot, lunch and learns on active offer, as opposed to full, as a preemptive to the full training. So I'm going to go back. Anna, I don't know if you have any other questions that you've wanted to mention, because I lost track after that.
Thanks, Deanne, and thanks, Sylvie, for your great presentation. So there's a couple comments just coming up in the chat around the challenge of doing meaningful translation of all materials, all OHT materials, and both having designated funds to do so, and maybe tools or resources to be able to support that. So I don't know if you are able to comment on that.
Yeah, so right now, the way it works in Ontario with organizations that are designated or identified under the French Language Services Act, they have access to ministry translation services. Unfortunately, at this time, OHTs are not eligible for those that translation services. So to be able to, so some of the organizations within OHTs that are designated or identified might be using those services as well for their patient related documentations to get translated, but as an OHT they can't. So that's a good question for the ministry. I know it's something that we've raised, as being an issue in certain areas for the OHTs to be able to do that. Unfortunately, at this time, there is just not enough. I mean, there's already a wait list for the designated, organized, and identified agencies to receive translation. So, and then with COVID lately, that's been the priority. So OHTs have unfortunately don't have access to it. So sorry. That's the best I can do, but definitely a good question and something we've heard and been asked about a lot, because it's important to be able to get access to that information and or to those services.
Great, thanks, Deanne. There was another a question that came up was around, you had mentioned satisfaction surveys and some of the tools to evaluate both access to services for Francophones and quality. And I'm just wondering if you could speak a little bit to those, the tools that might cross various levels of the building blocks. So looking both at like service delivery and also the health system aspects. And if you can speak to any of the evaluation tools that might support OHTs to do that work.
Well, we have, I can speak specifically for in our region. I know that we've worked on creating tools that the OHTs can use. For example, surveys that are already like written out and can be adapted to each different organizations. That's on our website, rmefno.ca, where you can kind of take those tools and kind of adapt them to your own organization. And I don't know, Sylvie, maybe you can go more in detail on some of the tools that might be, other tools that might be available. And again, I think the best bet is always to communicate with the entité in your region, because they'll also have developed certain things. But Sylvie, if you want to.
Yeah, on our website, you will find some templates to help you develop your own evaluation questionnaires, whether it's just quality of services, quality of French language health services, and they are available in French and English. because although some people may prefer to receive their services in French, when it comes to documentation, they may feel more comfortable using the English format, or again, both versions on one sheet of paper. So all our resources are available in French and English. We also have a questionnaire on the experience survey, which is different than evaluating the quality of care. And we also developed a process of complaints. If somebody has a complaint to make, or it's actually a complaint and complement of FLS process that we have on our website, which can be adapted to your needs, and that can be printed as a poster up on your reception area in your waiting rooms, and people can easily follow the steps if they want to provide some feedback on their experience.
I did see a question about organizational culture and what that would look like, and I think that's an excellent question. Organizational culture touches a lot of aspects, and we do go more into detail in the training modules. But just to give an overview, we look at stuff like, it's sometimes easier to explain what organizational culture is not. So, we've had employees that haven't been allowed to speak French amongst themselves within the organization because the language of the organization is English. If you really want to be able to promote the use of a second language within your organization, is you have to stop putting those barriers in place. So best practice that we have seen is, having little lunch and learn sessions where people can come in and practice their French with other, or not lunch and learns, but little sessions where, they sit down and it's like a little coffee break in French. Ensuring that the Francophone employees aren't overworked. If they are called to help translate in one department, then they're not having to then run back and do their work in the other department. Being able to share that load if they're off doing some help with French language services. But there is a lot more information on in the training modules about promoting a favorable or environmental culture that's conducive to French speaking staff, and as well for clients coming in, that they don't feel, oh shoot, I can't ask for services in French here. There's nothing that to indicate that there is French available. So being able to ensure that the environment demonstrates that, yeah, we're going to do our best to serve you in French. And even if we can't serve you, we'll find a way to ensure that you can communicate with us in French.
Great, thank you, Deanne. So we are at 1 minute to 1. So I would like to thank everyone who took the time to join our webinar today. And I would especially like to thank Jillian Paul for opening the webinar, as well as Deanne and Sylvie for your excellent presentation, and for all the discussion in the chat and comments. Here are two, just reiterating the resources around active offer training, and again, pointing to the RISE brief. And I'd like to thank you very much, and please don't hesitate to get in touch with the OHTs as OHTs work through providing French language services to your populations. Many thanks, everyone.
Anna, I have one question that was asked. Where are we at with the designation of OHTs? Asked by Rita. Excellent question, Rita. We're asking the same question, and hopefully we can get some answers soon. I know it's something that we've been told the Ministry of Francophone Affairs and the Ministry of Health are working at. So hopefully we can get that done shortly. Merci tout le monde. Thank you for being here.
Thanks, Deanne, for including that.